Well, sometimes I get asked, why neurosurgery and why brain tumors? Why is that an area that you want to focus in on? And I think some of that gets to the fact that the brain is, what makes you, you, and what makes me, me. It allows you to think, allows you to recognize your family, allows you to read, allows you to explore, allows you to innovate. I mean, there's so much that's wrapped up and centered in the brain. For me, it felt like an opportunity to really help people who, in some ways, are really looking for hope, looking for help in something that really hits for them at the heart of who they are. And being able to be that kind of doctor or that kind of surgeon and that kind of a caregiver really, is, I think, what is a big part of what drew me into neurosurgery. When you're caring for a patient who has a brain cancer, for example, even a benign tumor, but especially a brain cancer, obviously that's extremely stressful, anxiety-provoking, scary for them and their families and loved ones. And so the first part of my job, I believe, is to try to get them at ease about the diagnosis, trying to get them at ease about what the treatments and therapies that will be needed to help attack this tumor, and let them know that we're experts. It's a team of experts, and we're going to be with them, each and every day. Not only are we going to be providing the absolute best care possible that's available to us today, that we have a lot of research, a lot of new technologies, and a lot of innovation happening here. And some of those will be available to our patients in the form of trials. So you will have outstanding, leading-edge care in a very warm, supportive, multidisciplinary way. But at the same time, I think you can be rest assured that new therapies that are just on the horizon, that are just being evaluated in patients, you're going to have access to those. Getting to a place like Siteman, where these novel technologies, novel therapies, innovative clinical trials are happening, you can be rest assured that you're at the absolute cutting edge, and maybe even beyond that, in terms of what therapies can be applied to your particular disease, your particular cancer. For certain types of conditions like brain cancer, especially like glioblastoma, we know that team is not enough. We have to have scientists who are working on new discoveries. We have to identify the most promising discoveries and have systems in place to bring those to the clinic in early phase trials to be sure they're safe and also eventually show that they're effective. So then in the future, we can not only care for patients with current modalities, current approaches, but we can add on top of that with new therapies so we can improve the care of patients with difficult problems. We have an amazing team that is really dedicated to caring for patients with the cutting edge care now, but making care better in the future. And we are really excited about the path we're on, and I'm sure that patients are going to be treated even less invasively and more effectively over time as we go about our work.